today we are discussing telehealth for injury prevention. For those of you that are just tuning in or might be a little bit late, again, please go ahead and enter your name into the chat feature. That is how we will get an attendee list for your CEUs for this program today. So again, today our topic is telehealth for injury prevention. This is a pretty hot topic, and we're going to go through quite a few different aspects of that today. First of all, I wanted to say thank you to Abby and to the leadership at ASSP and to all of you members tuning in today. I really appreciate being here, and thank you for your time. Again, my name is Beth Mayotte. I am the program director for PDR Works. We are a provider of injury prevention services to employers in the Twin Cities and Upper Midwest. I'm an occupational therapist by background, and I am certified in ergonomics. That's my contact information there, bethm@pdrclinics.com. You can always email me or you can call me, and this will be on again at the end. If you do have questions as we go through the program, as we go through the slides, feel free to enter those into the chat, and Abby will be watching those and either punt them over to me as we go along or at the end. Our agenda for today, we will be talking about the purpose of telehealth and some of the factors involved with telehealth. We'll review injury prevention best practices and review benefits and costs. So we'll start today with the purpose of telehealth. We're going to end up looking at a few factors regarding that. So first of all will be COVID. That's on the top of everyone's mind as Minnesota has just exited stay-at-home orders, as well as some definitions and scope of practice. So as we know, Minnesota is slowly returning to business as usual. Employers have a lot of guidance and a lot of information coming to them right now from the Minnesota Department of Health, the CDC, OSHA, as far as returning to work practices for social distancing and sanitizing. Employees are just returning from furlough. Perhaps they are still working at home or they are working reduced hours. Those essential workers are perhaps coming back to new work tasks. They are maybe working longer or adjusted hours. Maybe they find out they have new products to make and new procedures to learn. Sometimes just entering the building will involve a new process and a new procedure for employees. And our new normal now includes phrases like work from home with kids, telework, telemedicine, and telehealth. And it can be a lot to kind of sort through that. So we're going to review some of those definitions today. So services are booming. We have a dramatic rise in telehealth services during this COVID crisis, and frankly, it's here to stay. We do have those barriers of cost and availability and relationship with a current provider that pretty much vanished when COVID hit, and the policies and payment of telehealth changed almost overnight. This crisis has really pushed us to mobilize existing technology very quickly and has brought increased accessibility and therefore, quite frankly, benefits to healthcare. So today we're going to look a little bit at an additional use of telehealth, which is injury prevention services for employers. For employers with multiple locations, such as a home office, a warehouse, rural communities, manufacturing facilities, warehouse, it can bring the same service to all employees. So an employee working from home or in a rural area has the same access as in office or other employees. We're using existing technology to bridge that physical distance initially, but it's now seen as a value add for businesses to connect quickly, easily, and at a very low cost. Employers have that opportunity to use technology to provide the support and injury prevention measures to their employees. Employers now are looking at the employee awareness and readiness for work. Both for the employees and the company, the challenge and the opportunity is to really bring those returning employees back to work gradually with monitoring and to reduce their injury risk. Especially those are at a higher risk due to deconditioning from furlough or reduced hours. Employees have had a dramatic shift in their physical requirements for their day, and depending on what type and nature of the job an employee is returning to, they may find themselves at a higher risk for injury. So employees need to be aware of that, employers need to be aware of that, and utilizing telehealth as an injury prevention tool is a great way to provide that awareness, support, and monitoring to your employees as they return to work. So we're going to start with a couple of definitions, and these are not mutually exclusive. They sometimes get mixed, and there's a variety of uses for both, but I wanted to draw kind of a line in the sand between telemedicine and telehealth. Depending on the company, they may intersperse these two definitions, but just to delineate the two, we'll use these for today. So telemedicine really allows for an interaction between a healthcare provider and a patient, and it uses a HIPAA compliant platform as medical information is being communicated over that video or telephonic service. It's applicable to a physician visit or a therapy appointment, and it would be billed to health insurance or work comp for that physician or therapy visit. We now find ourselves in a time of increased coverage from health insurers during COVID-19, including Medicaid and Medicare. On the other hand, what we're talking about today is telehealth for injury prevention. This actually takes place before a healthcare claim or work comp case is even filed, and it's utilized as part of an early reporting model at the employer location. So those employees' symptoms like soreness, discomfort, achiness, etc., are recognized. Interventions are applied, ergonomics are addressed, and the symptoms are resolved. The interventions that the therapist would do with that employee are within OSHA first aid guidelines, and throughout the process there is communication with the employer. So telehealth really is wherever you are, whether you're in a warehouse, whether you're at a construction site, whether you're in a biomedical lab, or working from home. Telehealth can be wherever that employee is located. Obviously, it complies with the COVID guidelines for cleanliness and PPE and social distancing. Right now, telehealth is a great option to jump those barriers. There is easy and quick startup. Typically, employees and the leadership are very engaged in that program as far as being able to set it up. And they're utilizing an online dashboard to request or schedule a visit. Typically, there's a toolkit of supplies that is at that location whenever possible. That's not always the case. And then a stretch program is typically running parallel with the telehealth program. Access is a huge factor, whether those employees are at home, at work, rural, metro, home office, corporate office, production, any of those factors or any of those locations can be addressed through telehealth. And what that does is it really levels the playing field. It brings the same service to all employees, and small or even underserved industries can really access services as larger corporations. And home office, that's definitely been a big topic these days. So it also extends to employees working from home. You never know what an employee's situation is like at home. They may have equipment they've purchased themselves. Maybe they have equipment that they brought from their office. Maybe they have equipment that they've just patched together with things around the house. We've seen a lot of really creative home office solutions and home office disasters. So having a skilled evaluator to really recommend improvements provides some coaching on how to set up their workstation in a way that's comfortable for them, and thinking kind of creatively and proactively to address any symptoms or questions that that employee working from home might have is one great application for telehealth. So really customizing your injury prevention program. It should be developed with your service provider to meet those companies' needs. And there's a variety of models that can be customized to your company. We're going to spend a little bit of time looking at the various models for injury prevention services. Telehealth is one way to provide care to those employees, and in-person methods can sometimes be a very nice complement to that program. So injury prevention models are typically customized to meet the needs of the employer, industry, number of employees, injury history, goals for the program. Those are all things that we would want to sit down with that employer and really make sure they understand each other. One type of injury prevention model is an on-site therapy model. This provides for structured time at the workplace, for example, Tuesdays from 3 to 7 p.m. every week, or Monday, Wednesday, Friday from 8 to 5, where an occupational therapist or a physical therapist is coming on site to that employer location and providing injury prevention visits, as well as ergonomic screens, job analysis, employee training and education. It allows for a lot of services to come to that employer location. There's also an on-demand therapy model. This allows for an on-site visit with a therapist and the employee within 48 hours of the request. So this is a more flexible approach than the on-site therapy model, where just call us when you need us type method. Telehealth, it is a video conference with that injured employee and therapist to address soreness. So telehealth and on-demand therapy model are similar in the fact that they're both an on-demand service, kind of pay for what you need as you go along. Scope of practice, this is something that's really important for employers to understand. The injury prevention specialist will be addressing musculoskeletal complaints. So soreness, discomfort, achiness, sharp feelings or tingling or numbness, things like that can all be addressed by that injury prevention specialist. As far as what they can do under OSHA first aid guidelines, there's a couple things. One is hands-on work for sore muscles. So really having that therapist be able to really get into that sore spot and really do some hands-on work is really effective in decreasing that soreness, providing some compassionate and empathetic coaching regarding what might be going on with them, just to decrease anxiety and concern regarding the soreness. Heat, ice, and taping is also under OSHA first aid guidelines. So application of a hot pack, a cold pack, kinesio tape, or rock tape, those are all within OSHA first aid guidelines as well. Soft supports. So this would apply to a knee or a wrist or something like that. That's just a soft support that provides maybe a little bit of compression. I really like to use soft supports if someone really needs a actual tactile reminder of, oh, I need to think about my wrist positioning for this task, or I need to make sure I keep this joint in a good position while I do this task because I know it's a little bit aggravating for me. And then stretches for general health. A stretch program should be implemented at the employer site. Just keep muscles loose, active, warmed up, ready for that work that they're about to do. So regardless of the method, whether it's on-site, on-demand, or telehealth, the scope of injury prevention specialist is the same. They would provide interventions for the employee who's experiencing musculoskeletal soreness or discomfort, and they always should operate under OSHA first aid guidelines. So that's why it's not skilled therapy, it's not billed to an insurer, but when performed by a licensed therapist or athletic trainer or something like that, you really get the best of both worlds. And most importantly, when it's paired with ergonomics and job analysis, then you've got a great combination of services, and it's kind of like layers of protection for the company. So I just wanted to walk you through an example of how we have seen this at work, and some of the flexibility that telehealth provides. So one of our employees that we worked with was a home office employee. Her name was Sammy. She had a complaint of wrist soreness that she believed was due to her job as an IT specialist, and happened to mention it to her safety director and mentioned she was probably going to be going to her chiropractor because she was concerned about it and wanted to not feel sore anymore. The safety director had a conversation with her and said, you know, let's have you try an on-demand visit. We have a therapist that can come out and work with you and see what's going on. So after that, we were able to see her for 2 visits at her work site. And then when COVID happened, she was moved to her home office to continue working from home. And at that point, we transitioned her to telehealth and were able to take a look at her workstation setup at home from working from home. And it was really a great combination for her. We did a lot of coaching on stretches, icing. She did have a wrist soft support that she had purchased on her own that we coached her on, and were able to kind of talk her through that. And then setting up her workstation at home and task management from her home office. So she just required a total of 4 visits, and at that point her symptoms were resolved. This was a great example because she was considering going to a provider, and we were able to kind of reroute her to the injury prevention services and not have a work comp claim or a health insurance claim. So now we're going to move on to best practices for injury prevention. We're going to spend a little bit of time talking about an early reporting model. We'll also discuss follow-through and data and return on investment. So an early reporting model can be utilized as part of an injury prevention program at the employer site. It's implemented after the employee reports soreness, and it's a service that can be coordinated through the safety director or HR. So the first step is that employee reports, hey, I'm sore. I don't really know why. Might be from what I did the other day at work, might be from what I did over the weekend or last night at home. I'm not really sure. The employer then has the opportunity to address some of those symptoms through telehealth or an on-demand model. And that telehealth session with a therapist is part of that injury investigation or injury solution process. So most of us are familiar with the process, a kind of a typical process, and maybe as we walk through this, see if this sounds familiar as far as how your company handles early reporting. So it typically starts, obviously, the employee feels sore. They're not really sure what's happening, but they're sore. Perhaps they continue to work, keep coming to work every day. The supervisor, human resources, and coworkers are not really aware that that employee is sore. And that soreness over time just gradually increases. The employee might even call in sick due to their soreness. Therefore, that leads to decreased productivity for that unit or that line or that group or even that entire employer. And the employee finally goes to the doctor and says, I have a work injury. I've been hurting for a long time. At that point, the employer is notified, and we're already into a work comp injury and OSHA recordable situation. So the goal is to really catch it early and prevent that injury. So an early reporting model would really be implemented right when that employee first says that they are sore. So a prevention model would look a little bit like this. The employee feels sore and reports that soreness, whatever the company's protocol is, whether that's to the safety director, HR, their line supervisor, whatever that process might be. The on-site therapist or telehealth can address that soreness under OSHA First Aid. The therapist monitors that work environment and can make recommendations. The employee is receiving care and is involved in the resolution of their symptoms, and works with the employer if there are any further changes that are required, such as changing a work process or pacing or perhaps relocating certain items to accommodate that employee. And those last two circles are a bit of a circular process. So being able to kind of live in those last two stages for as long as necessary until that employee starts to improve. And that employee continues working throughout that process. So that's really the goal of that prevention model. So what does a session include? What exactly does an on-site therapy or telehealth session look like? So once that employee reports an injury, we're going to do some questioning about exactly what happened. What was the event? what was the incident, if that's even something that they can pinpoint. Sometimes they can't. They just say, I don't know, I've been hurting for a while. So we'll talk about work-related and non-work-related factors that may have led to that soreness. For example, if they have a hobby outside of work that utilizes those same muscles, we might have to talk about that. We may also talk about things like childcare. We might talk about sleep habits, sleep positioning, and things like that. We'll do a review of systems. So symptoms would be soreness, discomfort, achiness, if they have any tingling, any swelling. We'll do an assessment, a physical assessment. So active range of motion, making sure they can move all those pieces and parts, looking at their ease of movement, and talking about any activity limitations they have due to symptoms. For example, I'm no longer, because of my shoulder, I'm not able to wash my hair in the shower, or I'm not able to do this work task because my shoulder hurts. If possible, we'd also do a video tour or an ergonomic screen. So if it's possible over a telehealth visit to take whatever video device they're utilizing, whether it's an iPad or a tablet or even a phone or something like that, to show me their work area. What does it look like? What types of tasks do you need to do? If telehealth is used in combination with an on-site therapist that knows those things, that's a great complement to be able to say, oh, I've seen your job. I know exactly what you do. So that can really help isolate those work tasks that might be problematic. And then, of course, interventions, coaching on manual work, how to do that on your own, how to apply heat and ice, when and where and how often. Taping, being able to coach someone over the video service to apply tape in a way that's helpful for them. And then, of course, coaching and stretches, work task changes, modifications, maybe some accommodations that they need to make at home, all with the goal of relieving symptoms. And then, of course, coming up with a follow-up plan, including any home cares that that individual needs to do at home. As far as follow-through, that injury investigation process can continue through ergonomics, taking a look at what are those non-neutral postures, job analysis. Those are additional things that can sometimes go parallel with that injury prevention sessions. Symptom recognition, being able to track and monitor those symptoms throughout the visits. Perhaps after we've seen someone for a couple of visits, we are able to delineate what's aggravating at home versus at work. Symptom resolution, there really isn't a limit or a time frame on number of visits. There's a couple caveats to that as far as making sure it's in the best interest of that individual to continue with injury prevention and helping them decide, yeah, I'm at the bottom of my bucket here. I've thrown everything I can at you and it doesn't seem to be changing your symptoms. So maybe it's time to go into the doctor and really figure out what's going on. And compassionate coaching and a team approach, really having good communication, being able to update safety directors, supervisors, and those key players with if there's any work task changes or if there's been any modifications that have been recommended ergonomically. Being able to identify and measure the goals of the employer. This is a really good, important conversation to have. So the employer hopefully would be able to provide some information and some guidance on what their goals are. For example, where are the injuries occurring? What department, what job title, perhaps what body parts are being most injured, and what are the goals? Are we looking at really trying to decrease the recordables or healthcare costs or lost time? Some companies really struggle with how to accommodate injured workers, and once they're out, it's really hard to bring them back in because they don't know what tasks they're able to do. So those are all things that can be addressed. And also data, being able to track that telehealth program or that on-site program and being able to have some data on how many visits are required or how many visits are typically occurring before resolution of symptoms. Are they able to work at full duty after injury prevention interventions and visits, or any other success measurements that that company has in mind? So I wanted to bring up another example of an individual that we worked with that kind of highlights this. This was Mary. She was a medical device assembler. She had worked for 19 years at a large medical device company and assembled very small parts in a clean room environment. And she reported non-dominant wrist soreness, which was a bit confusing to the employer. So the supervisor went ahead and scheduled a telehealth visit. And during that visit, Mary was able to demonstrate her work process. And kind of through that visual demonstration, we talked about some aggravating postures that she was participating in as part of her work tasks and that assembly. So we talked through some modified techniques and different ways that she could still get her work done at the pace and the requirements for her job, but provide her with some better wrist positioning. And ended up seeing her for about 4 visits, and at the end she had a resolution of those symptoms. But the best part was that she was able to demonstrate that modified technique to her coworkers and supervisors. And there was a lot of encouragement and excitement over, yeah, that is a better way to do this, and provides some flexibility for employees to make sure they're taking care of their body parts and taking care of their health. So let's talk a little bit about the payoff. What are the costs and what are the benefits? There was recently a Minnesota Workers' Compensation Insurance Alliance annual report for 2019. This was published in January of 2020. And it was something that we spent some time here discussing the takeaways. And a couple things stood out to us here. That low back is the most frequently injured body part, followed by the knee and the shoulder. The Twin Cities saw the lowest percentage decrease in indemnity cases when compared to other Minnesota regions. And strain injuries, they are still the most frequent lost time injury. And the average cost of a strain injury is $24,318 per case, which is quite staggering. Manufacturing actually had the smallest decrease in premium reductions. So I do like to bring these out because it just drives home the fact that while there's a lot of good data coming out of companies that are really taking the time to put safety at the forefront, there are some indicators that this is something we need to keep plugging away at for sure. So again, we talked earlier a little bit about that reporting of a workplace injury. I wanted to put this in here just to understand that when a work comp claim has been filed or a health insurance claim is initiated, the employer is a bit more in a passive role. They're really not able to control those outcomes, the timeline of when that employee is able to come back to work, and they certainly can't control any costs. So additionally, sometimes communication is very limited or delayed, or involves multiple entities and lots of key players. So meanwhile, those costs rise. A low back injury involving prescriptions and therapy and doc visits, injections, potentially even imaging and surgery. Those costs add up really quickly, between $40,000 and $80,000. And this is just direct cost. So the indirect costs of lost time, decreased productivity, training other workers, perhaps hiring new workers, all of this drives indirect costs, which are much higher. So let's talk about injury prevention programs. Work comp back injury, we kind of just went through all of those, what those direct costs are and how indirect costs add to that. And the employer really doesn't have a lot of control over that process. So an injury prevention program, let's take, for example, 6 to 8 telehealth visits. That's less than 5% of a work comp back injury cost. So it is a very cost-effective alternative to going down that work comp or back injury route. those indirect costs significantly reduced, so there's no lost time, productivity can continue, and that employee can continue to work. And again, going to communication, that employer is aware and involved in the care and progress of the employee. COVID does have a lot of unknowns. We do have employment hovering about 15%, with most workers temporarily furloughed. So that COVID cost is something that we don't quite know yet. We're not sure what's on the horizon. Workers are returning deconditioned. They have new risk factors than they had before. Multiple research and articles have been written about work comp cases are expected to rise, increased injuries, as those physical work demands really exceed that worker capacity. So cost-effective solutions to protect the employer and the employee are really a benefit to both individuals. And I like to refer to it, it's like a layer of PPE for your company. So the benefits of telemedicine and telehealth, it benefits, like we said, both the employee and the employer. It gives really quick access, faster access to care for that injured worker. They have decreased lost time from work, lost instructional time, decreased dependence on substitutes to cover while those employees attend medical appointments, and less time and expense associated with traveling to the doctor appointments and waiting for an exam. And like we said earlier, work comp insurance is paying for those telemedicine visits. So on the telehealth side, who really benefits from that? One employer with employees in multiple locations. Remote areas can access the same services as metro locations, and those small or underserved industries or small companies can really access the same level of services and care for their employees as larger corporations. And any employer looking to expand their injury prevention program or even start one. As far as added benefits, there are several. So increasing early reporting, decreased recordables, improved productivity. We've talked about that a lot. Having that employee being able to be treated right at work really decreases the chance for productivity to be affected. Increased employee satisfaction. We haven't talked about this a whole lot, but having an employee that really feels that their employer cares about them and that they feel valued is priceless right now. It's very important to have those employees feel like they are being heard and that their symptoms are being addressed. So improved communication between departments is also another benefit. So HR and safety, or HR and the OHN being able to have communication around what's going on with their employees. And moving from a reactive position as far as injuries are concerned to more of a preventative position. Moving in this direction is very important and is a great shift for a company in parallel with their other safety programs, moving to that preventative injury care. And it complies with any social distancing guidelines. Another added benefit is that the telehealth really engages the worker in their own recovery. So because that telehealth session just takes a short bit of time, perhaps under an hour, and then as frequently as that employee requires, they're really going to be doing quite a bit of work on their own at home or at work. So engaging them in their own recovery to apply heat or ice when they need it, to do their stretches throughout their workday or at the start of their shift, being able to understand how to tape themselves, when to use their soft supports, taking a look at work task modifications, the ergonomics piece, communicating with their team members and their supervisors, being able to talk to someone about how does nutrition affect this? What can I do cardiovascularly? Can I still go for my long walk with my dog? Can I still eat what I want to eat? Will that affect my injury healing? Or stress reduction. Employees are at a high level of stress these days, so being able to talk to them about that through that telehealth visit is really important. any changes to their sleep patterns, sleep positioning, really having them be involved in that process and understand that their behaviors really affect their health is very important and is a great benefit of telehealth. So one last example is Bob. He is a material handler. He has a lead position at a large company in the shipping and receiving division of his company. He works full-time unloading and loading trucks for deliveries. And he did report low back soreness. He's a little bit of an older gentleman, and he had worked for many, many years at this employer, and wasn't able to delineate an exact date and time that anything happened to him. Just had noticed that his low back had become sore more often over the past few weeks. He actually had a physician visit scheduled and happened to mention it to his supervisor. His supervisor encouraged him to start at least with a telehealth visit and meet with the therapist and ask some questions, get some advice before he went to the physician and see if that was helpful for him. So he was able to have a telehealth visit the following day after he discussed this with his supervisor, who provided him with home cares and some stretches to do over the weekend, so heat and ice. We had Bob's spouse help with putting some tape on him, and he found that very helpful. So he ended up not going to the physician. We saw him for a total of 6 telehealth visits, and at the end, his symptoms had resolved quite a bit, but most importantly, he felt like in his toolbox of self-cares and his toolbox of coping skills, he had a lot more things that he could employ on his own when he was feeling sore. So discussion about, maybe this isn't something that's going to go away forever, but being able to understand that when you do feel soreness or when you have these little things that happen to you that indicate you might be getting more sore, try some heat, try some height, some heat and ice, try some taping, etc. And that was a real help to him to know that he could implement those things on his own when he needed to. So just a brief summary of what we talked about today, and then I'll take any questions that you guys might have. So the purpose of telehealth, it's an injury prevention video visit with a therapist to prevent work comp or healthcare costs. Best practices include providing access for all employees in an organization, regardless of the location, the job type, or the status. And the payoff, really important. Injury prevention methods can decrease those costs for a company, and most importantly, they're customized to your business needs and goals. So that's all I have. If you guys have questions, if you have anything that you'd like to ask me or clarification on anything, feel free to send those over to Abby.
Thank you, Beth. This has been a really good presentation. I think a lot of us are probably kind of just thrust into using a lot of these online tools, whether it's telemedicine or something else. And so there's a learning curve, I think.
For sure.
I have a question about that. Do you spend a lot of time on these telehealth visits, just kind of laying the ground rules, or so people understand even how does this work?
Mm-hmm. We have a pretty good setup on our end here at PDR Works. I think each service provider probably has a different system as far as how they connect with employees. We use GoToMeeting. And so we are able to send a link to that employee. We're able to connect with them, just like all of you did today. And then once it's up and running, I'm here or a therapist is here talking with them and kind of coaching them through the process. So we have the time to work through any technical issues that they might have, as well as injury prevention care.
Another quick question.
Yeah.
I know that COVID is really prompting a lot of people to use more telemedicine, telehealth, and maybe they're being converted and see that it's a great resource. But how can we, I guess, increase that utilization or keep that that interest there
Mm-hmm.
for the workers or for others that might be in different departments that we have to work with to maybe make them understand that this is still a great option, even when we're going back, like things are reopening, and that they
Mm-hmm.
could still physically go to a doctor's office, but maybe that they should consider the telehealth version instead.
Mm-hmm. I think that's a two-part question. I think if you're talking on the telemedicine side, as far as actually having a telemedicine visit with a physician versus going in to see the physician, in person's always preferred, right? That's always best. Um, but I think too on the telehealth side, when you're looking at injury prevention before they go to the physician, and trying to implement something so that they don't have to go to the doctor, one of the advantages of telehealth obviously is that it can service all of those employees regardless of where they are. And I think kind of our new normal is we are going to have some people working from home. We're going to have some people in the warehouse. We're going to have some people at the corporate location, or what have you, whatever your company makeup is. So being able to say, you know what, this is regardless of where you work. This is regardless of what type of job that you have. It levels that playing field significantly. So if you have a company in Blaine and you have someone that works in Fargo and they have someone that works in Duluth, well, that's fine. Telehealth for injury prevention can cover all of that.
I think you mentioned it, that there's kind of like an equity on
Mm-hmm.
this, that, or
Mm-hmm.
a continuity of care
Mm-hmm.
and how it works. So I like that aspect. And I mean, I don't want to talk about winter, but I think like in the winter time or other times when travel might be difficult, that
Mm-hmm.
this can be a really nice option
Mm-hmm.
for those times as well.
Mm-hmm. Mm-hmm. Exactly. And I think for employers that struggle with, well, we're located here, and I don't want to have to pay for my employee to go visit someone that's of their choice or down the block or 15 miles away because that's who they've always had this, longstanding relationship with. Um, Telehealth for injury prevention, they're going to be seeing that same therapist throughout that process, and the service comes to them essentially, so they don't have that travel time, they don't have that lost time from work, etc.
What about for workers that might be slow to adopt something like this, or
Mm-hmm.
that they think it's not as good as in person? I mean, I know you said that in person is preferable, but I still
Mm-hmm.
think that there's maybe specific instances where telemedicine could be preferable. So are there strategies that you would recommend to maybe prime our workers to be more open to using these types of solutions?
Mm-hmm. Yeah, good question. Yeah, I think COVID has pushed us into some things that we normally would not have. We wouldn't be doing these things if it wasn't for COVID. And obviously, there's a lot on both sides of that, negatives and positives. But um, I think workers that are coming back to work, they're coming back to a lot of things that are new. They're coming back to different sanitization processes. They're coming back to different expectations for their health. They're coming back to new policies, new procedures, perhaps, like I said, new products. So in some ways, it's a good time to start something new, because there is so much that's new, and being able to implement a telehealth program for injury prevention, again, it's another layer of protection for that employer and that employee to be able to say, you know what, we know now a lot more than we knew a couple months ago, and we have methods and we have process and we have beneficial things that we would like to provide to our employees. So um, I think through this time, we've seen some national examples and even local examples of companies that really take care of their employees during this process, and call out, this is a stressful time, this is a busy time, we want to take care of you, we value you. And I think this is a service that employees feel that and they see that.
Yeah, and why add more stress right now?
Right. Yeah.
Yeah, that makes a lot of sense. Um, let's do a last call for questions, and then just a quick reminder: if you haven't added your name to the text or the chat log here, please type in your first and last name, so we can make sure that you're in as far as attendance. And then again, if you have been on the phone the whole time, make sure to reach out to me. You can send an email to president@northwest.asssp.org, and I will get you on the attendance list, which is important for your CEUs for this. So I see some people, they're like, oh yeah, that's right, I got to do that. So type in your questions if you have any remaining. Otherwise, I might have to just ask my own questions. Have you guys had any other success stories related to using the tele methods lately?
Are you asking me or everyone
Yep,
else?
asking you.
Yeah, I mean it's been a great service so far. PDR Clinics also really did a nice pivot and was able to provide telehealth on the clinic side. So there's been lots of success with that. For people that were not comfortable coming into the clinic during the stay-at-home order, especially right when things first started back in March. So PDR Clinics has had a lot of success with the telehealth option. The physicians, I believe, love it, and it's working really smoothly on the clinic side. And as far as PDR works, it's been a great complement to our in-person services as well. So just knowing that employees can kind of come and go from an in-person visit to a telehealth visit allows us a lot of flexibility to get people the care that they need right at work or at home, wherever they are. So it's been good. I don't know if that answered your question, but
It does. Yeah, I think the tools have been out here, so it's been nice. I mean, not nice, I shouldn't say nice, but like the COVID stuff has been a catalyst for people
Mhm.
to have to suddenly get very familiar with using these things.
Right.
So there's a question. This may have been covered in the presentation because someone's webinar connection was interrupted. Now they're back.
Oh,
But
shoot.
Beth, can you comment on how telehealth can fit into workers' comp claim treatments?
Yes. So, good question. So, the presentation today was on telehealth for injury prevention. So ideally, implementing telehealth for an employee as part of an early reporting model before they're going to the doctor and initiating that work comp claim. Once that work comp claim has been initiated and they're being treated by a physician or by a skilled therapist, typically telehealth for injury prevention backs out at that point because we want to make sure they get the skilled care that they need. However, the ergonomics piece is something that's very beneficial to that employer and that employee. So you could do a telehealth visit as far as their return to work program. How do we accommodate this employee given their work ability? What different tasks or different tasks or different jobs might be applicable to them during this time. And sometimes that's really helpful to the employee to kind of understand, okay, how is this going to look when I go back, given I can't, lift my shoulder above, shoulder height, or I can't lift more than 5 pounds because I'm in therapy right now. I'm working with the physician and the therapy team, but I'm not sure what it will look like when I go back to work. So telehealth can help with some of that as well.
Awesome. Another person says, I'm a huge fan and supporter of using this method as a preventative tool, but how do you thread the needle of not prescribing home exercise program as treatment to avoid OSHA recordability?
Yeah, good question. Excellent question. Thank you for that. Yeah, it is threading the needle. I think having a service provider that really understands both sides of that coin, because you as an employer don't want to have you be at risk for an OSHA recordable or worse, because you have a provider that is actually prescribing. So for those of you that are unfamiliar with this, the therapist needs to stay within OSHA guidelines. So the minute that they prescribe specific activities or specific exercises, saying, you know, I want you to do this exercise this many times per day or this often per week, when it's prescriptive and individual to that person, that is an OSHA recordable because it is skilled care. So you want to make sure that that provider really understands that delineation and stays firmly on the OSHA guidelines side of the coin. And it's challenging. As a therapist, you sometimes know, or you sometimes want to toe that line. So you have to make sure that that service provider is being really respectful of that.
So someone added in the comments to have a large bank of wellness and exercises for all
Mhm.
employees to help cover that.
Yes,
So
exactly.
keeping it general.
Yes, exactly. So that's why I mentioned with a telehealth program or an on-site, on-demand program, you should always have a wellness program or a stretching program that is applicable to everybody, so that the therapist can say, these are stretches and things that are good for general health. These are things that you should be doing throughout your workday and at home as well. So on our side, on PDR Works, we provide that to the employer. We say, here is the stretch program. We go in and make sure that everyone's familiar with that, and it's across the board for everybody.
So I'm not seeing any more questions come in, but I just wanted to, I guess, respect the fact that this was supposed to be an in-person meeting at one of your newer locations, and we were going to have a tour and do some hands-on stuff. So maybe just to close it out before I adjourn the meeting, do you want to give us just a quick overview of that new location and maybe something interesting or something that we missed by not having
Oh,
this in
sure.
person?
Sure. Yeah. Thank you for that. I kind of forgot that that was supposed to be in person. It was so long ago. Yes, this was scheduled to be an in-person event here at our PDR Clinics location in Edina. We have just moved into this space last September, and it's a beautiful space that we were really looking forward to showing off to everybody. We have 5 clinic locations throughout the Twin Cities, and our Edina is our corporate location. So our administrative team is here, as well as our founder and executive director. So yes, the original plan was we would provide lunch for everybody and a tour of clinics, and then I would provide this CEU portion while you enjoyed your lunch. So maybe you're still enjoying your lunch. But yeah, so it's a beautiful space here. We increased by 2,000 square feet, I believe, and we've filled it up to the max already. But we're very happy here, and it's been a great transition. So yeah, thanks for that.
That's awesome. Yeah, maybe some people did enjoy a lunch.
Yeah.
I just still have this morning's coffee, so we'll have to work on that for future virtual meetings and maybe find some kind of food tie-in because I think people might be missing the food and
Yeah.
the networking, just the open
Yes.
networking. So
Yes.
we'll get back there at some
Yeah.
point. So I'm not seeing any other questions. Is there anything else that you wanted to just kind of overview to wrap it up?
I don't think so. I think if anyone has additional questions in the future, you're more than welcome to call me or email me. My contact information is there on the screen. You can always ask Abby. She knows how to get hold of me if you forget all this information. Um, but yeah, we'd love to have conversations with people if there's anything that's working for you. If you have used telehealth up to this point or on-site providers up to this point, and you're looking for additional information, or how do I get started, or I'm considering this but not quite yet, we'd love to hear from you. So that's always an option too. So thank you for today. I really appreciate the time to meet with all of you, and hope you have a great day.